If an employer has not developed a safe system of work, what should be your main concern? Give one answer. A. Nothing. A safe system of work is optional. B. That they are breaking the law. C. That you become liable for any accidents. D. That you need to pay extra attention. Correct answer. B. That they are breaking the law. What is the role of surveys in the safe system of work? Give one answer. A. They determine where scaffolding will be placed. B. They ensure staff concerns are being properly attended to. C. They help determine whether a project has been safely completed. D. They indicate potential hazards. Correct answer. D. They indicate potential hazards. What should you do if you have an accident? Give one answer. A. Ensure it is logged in the accident book. B. Report it to your supervisor or manager. C. Report it to your supervisor or manager and ensure it is logged in the accident book. D. Resolve the issue and continue working. Correct answer. C. Report it to your supervisor or manager and ensure it is logged in the accident book. You are unable to perform work duties for 7 consecutive days due to injury, but you are self-employed. Will your employer still need to report this to the HSE? Give one answer. A. No. B. Yes. Correct answer. B. Yes. You have been in an accident and are unable to record it in the accident book yourself. What happens now? Give one answer. A. For accidents this severe, a different procedure is followed. B. Someone must record it on your behalf. C. Someone must record it on your behalf and provide their details in the entry. D. You must record it once you are able to do so. Correct answer. C. Someone must record it on your behalf and provide their details in the entry. Which of the following is a respiratory hazard? Give one answer. A. A hacking cough. B. Chewing gum. C. Dust from construction. D. Poorly fitted respiratory protective equipment. Correct answer. C. Dust from construction. Which one of the following is a good way of confirming your mask is well fitted? Give one answer. A. You can bow your head without it shifting. B. You can insert one finger comfortably between the mask and your face. C. You cannot smell anything. D. You pass a face fit test whilst wearing it. Correct answer. D. You pass a face fit test whilst wearing it. What is the most dangerous condition associated with asbestos inhalation? Give one answer. A. Cancer. B. Dermatitis. C. Leptospirosis. D. Occupational asthma. Correct answer. A. Cancer. How might you know if you have developed metal fume fever from welding? Give one answer. A. You begin to develop flu-like symptoms a few hours later. B. You begin to develop hand tremors whilst working. C. You begin to feel feverish whilst working. D. Your jaw becomes stiff a few hours later. Correct answer. A. You begin to develop flu-like symptoms a few hours later. Your respiratory protective equipment, RPE, must form a snug seal against your face. Which two factors might affect the fit? Give two answers. A. Dusty atmosphere. B. Facial hair. C. Goggles. D. Soft skin. E. Temperature. Correct answer. B. Facial hair. C. Goggles. Which condition is most likely to be caused by long-term exposure to fumes or dust? Give one answer. A. Dermatitis. B. Heart disease. C. Lung disease. D. Mouth cancer. Correct answer. C. Lung disease. Which three of the following statements are true about blue-coated tools? Give three answers. A. The shock can be fatal. B. The shock will not be fatal. C. They are uncommon on construction sites. D. They use 180 volts. E. They use 230 volts. F. You will see them frequently on construction sites. Correct answer. A. The shock can be fatal. C. They are uncommon on construction sites. E. They use 230 volts. What two ways will blue-coated voltage most frequently be used on site? Give two answers. A. To distribute electricity. B. To power generators. C. To power most tools. D. To recharge electric vehicles. Correct answer. A. To distribute electricity. B. To power generators. The conditions on site have become wet. What three kinds of tools should you be using? Give three answers. A. Air-powered. B. Electricity-powered. C. Fuel-powered. D. Generator-powered. E. Non-powered manual. F. Sustainably powered. Correct answer. A. Air-powered. C. Fuel-powered. E. Non-powered manual. You were issued ear defenders, and the soft inner lining is torn on one side. What should you do? Give one answer. A. Find a team member with functioning ear defenders and alternate using them together. B. Find some soft material to pad the damaged side. C. Wait until you are issued with a new pair before you work in noisy areas. D. Work with this pair, as the damage is only cosmetic. Correct answer. C. Wait until you are issued with a new pair before you work in noisy areas. What should you expect from your employer regarding information about the risks of vibration exposure? Give one answer. A. A general overview and a willingness to answer job-specific queries. B. An on-site medical consultant. C. Clear, specific information in training sessions. D. Nothing. It is your responsibility to be informed of the risks. Correct answer. C. Clear, specific information in training sessions. What should a construction site be mindful of when sourcing timber? Give one answer. A. It should come from forests that are sustainably managed. B. That it can be responsibly stored on-site. C. That it does not produce harmful smoke when burned. D. That the wood comes from fast-growing species. Correct answer. A. It should come from forests that are sustainably managed. You are washing out a ready-mix concrete lorry. What pollutant risk must you watch out for? Give one answer. A. Fumes being emitted into the atmosphere. B. Hazardous dust. C. Residue clinging to your hands. D. Washout water leaking into the ground. Correct answer. D. Washout water leaking into the ground. You notice sewage running down a red drain. What do you do? Give one answer. A. Inform the site manager. This is not permitted. B. Nothing. This is correct. C. Use a drain cover to block the opening. D. Use a spill kit to stop the flow of liquid. Correct answer. B. Nothing. This is correct. What are the steps you must follow when involved in a chemical spill? Give one answer. A. Evacuate, report, regroup. B. Notify, contain, record. C. Stop, contain, notify. D. Stop, evacuate, notify. Correct answer. C. Stop, contain, notify. Which of the following is top priority when it comes to managing a site's waste output? Give one answer. A. Correctly disposing of waste. B. Educating employees on sustainable practices. C. Preventing the creation of waste. D. Recycling waste for other uses. Correct answer. C. Preventing the creation of waste. Excavations are considered dangerous at what depth? Give one answer. A. 1 meter. B. 3 meters. C. 50 centimeters. D. There is no specified depth for dangerous excavations. Correct answer. D. There is no specified depth for dangerous excavations. When should excavation supports be installed? Give one answer. A. Before anyone enters an excavation. B. If there has been heavy rainfall on site. C. If there is thought to be a high risk of collapse. D. When the excavation is deeper than 2 meters. Correct answer. A. Before anyone enters an excavation. Who can use scanning equipment? Give one answer. A. All workers who will be carrying out an excavation. B. Only a specialist contractor. C. Only competent, trained, and authorized people. D. Only the person conducting the risk assessment. Correct answer. C. Only competent, trained, and authorized people. You smell rotten eggs whilst working in a sewage tunnel. What does this mean? Give one answer. A. Nothing in particular. B. The sewage is giving off hydrogen sulfide, which is harmless. C. The sewage is giving off hydrogen sulfide, which may create breathing difficulties. D. There has been a methane leak, and you must leave the tunnel immediately. Correct answer. C. The sewage is giving off hydrogen sulfide, which may create breathing difficulties. What should be the last resort according to the hierarchy of control? Give one answer. A. Not working at height. B. Preventing a fall from happening in the first place. C. Using collective protection to limit the consequences of falling. D. Using personal protection to limit the consequences of falling. Correct answer. D. Using personal protection to limit the consequences of falling. What is best practice when beginning work on a roof? Give one answer. A. Assume it contains asbestos. B. Assume it is fragile, unless a competent person assesses it to be safe. C. Assume it is safe, unless a competent person assesses it to be fragile. D. Assume you must wear a harness at all times. Correct answer. B. Assume it is fragile, unless a competent person assesses it to be safe. You need to begin a task, but the access ladder is barred off with tape. What should you do? Give one answer. A. Do not begin work and consult your supervisor. B. Inspect the scaffolding for hazards and continue if it appears safe. C. Remove the tape so you can get through, but replace it behind you. D. Remove the tape so you can safely access the scaffolding. Correct answer. A. Do not begin work and consult your supervisor. What two things will ensure a ladder can be used to safely access a scaffold? Give two answers. A. It extends 1 meter above the platform. B. It extends no more than 12 inches above the platform. C. It has been ballasted at the bottom. D. It is securely tied. E. The rungs are mostly secure. Correct answer. A. It extends 1 meter above the platform. D. It is securely tied. A single ladder may carry how many people? Give one answer. A. Multiple people if their combined weight is under 30 stone. B. One person only. C. Two people if they are distributed across the length. D. Up to 3 if the ladder is industrial grade. Correct answer. B. One person only.